your advisors, and this is the third in a series of 3 videos explaining the Part D reports for the new Medicare Plan Finder. So you might be getting this or watching this video because you got an email from us that you want to understand how to read the report. You might just be doing this analysis on your own and you want to understand these reports. This is a video to help walk you through the report. This individual in this example has very expensive medication costs, and they've reached the final phase of Part D of Medicare, which is catastrophic coverage, where you only pay 5% for the expensive medications. So I'll explain to you how that works with this report. And there's other videos we have out there that explain how Part D of Medicare works, the different phases of Part D. But this video is specific to reading the report so you understand how this works. This plan that came up most cost effective is called Mutual of Omaha Value. It has a premium of $24.90 per month, a $435 deductible, and that's basically the information on page 1. Page 2 has a little table here that shows you the tier drug cost for each of the different tiers if you use a standard pharmacy for 1 month supply of your medications. But where it gets interesting is on page 3, where the costs are broken down by the pharmacy. The pharmacies that were selected for this individual happen to be CVS and Walgreens. So we're going to walk through the pricing for each of those, as well as for mail order if you choose to get your drugs via mail order pharmacy. This person's taking 4 medications. You can see them listed here. The 2 expensive ones are the Restasis and the Xarelto. Okay, you can see the full retail cost of each of these is almost $500 or over $500 a month for these medications. So the cost before the deductible, that's really a little misleading, but you pay the full cost really of those brand name drugs until you reach that $435 deductible. Okay, so basically, it says $546 and $439. It's really, you're going to hit the $435 deductible with either one of these the first time you fill it. Once you hit that deductible, then you're in the cost after deductible phase, which these 2 medications still have a 0 copay. The Restasis would be $28 and the Xarelto would be $28 for the cost after deductible. If you have expensive drugs like this individual, you're going to reach the coverage gap. It's also called the donut hole, where you have to pay 25% for those brand name drugs, which would be $136 a month for the Restasis and $109 for the Xarelto. So I'll show you when they're going to reach that coverage gap, and you'll see that month by month how that affects their costs in the next chart. And then the cost after the coverage gap, this is for the people that have, again, very expensive medications, so you're not stuck in that coverage gap for the entire back half of the year. They're going to reach that the catastrophic level, it's called, where they just pay 5% the cost of those drugs. So $27 for the Restasis and $22 for the Xarelto once they reach the catastrophic. All right. Now, the next section here gives us the total cost for the year, which is the most important number. This is really how we pick the drug plan. We look for the lowest overall cost for the year, which is the premium plus the drug cost for the entire year. The drug cost includes the deductible, the initial coverage level, the catastrophic, the donut hole, if you're the coverage gap. All of that's factored into that one number. And there's 30 different drug plans out there, so we're looking for the lowest overall cost. And in most cases, that's probably going to be the best plan for the individual. And this individual, it gives us the breakdown. They're going to reach their deductible in January. It tells us they're going to reach the coverage gap in May of their drugs. So the chart breaks it down by month, and you see the first month is very expensive because of that deductible of $435, and then the next 3 or 4 months, 1, 2, 3 months, they're just paying that $56 a month. That's the initial coverage level copay for each of those 2 medications, really the Restasis and the Xarelto. But in May, they're going to hit that donut hole, or the coverage gap, where they have to pay the 25%. And that's where it goes up to that $250, really through May through October. By November, they're going to hit that catastrophic, or the last phase of Medicare Part D, and that's where they pay the 5%. So their cost drops back down to about $56 in December. So that's how the different phases of Part D work: the deductible, the initial coverage level, and then the coverage gap where it goes up to 25%, and then catastrophic where it drops back down to 5%. This is, again, only for someone that has very expensive medications. If you're just if your total drug cost for the year is less than $4,000 retail, you're never going to get to this coverage gap. Okay, you're always going to be in that copay phase if you've got the lower drug costs for the year. All right, and these totals do not include the premium of the $24.90 per month. So if you add up all of these months drug cost plus $24.90 a month times 12 for the $24.90, you get that total number we just looked at, which was the $25.43. All right, that's how you get the total cost for the year for this particular plan with this pharmacy with these medications. Okay, and then everything in this report just repeats now for the other pharmacy. For Walgreens, which is a standard pharmacy, you're going to see higher drug cost and therefore a higher total cost for the year. It's going to give you, you could still use it there if you choose to, but you're just going to pay more for your medications with this plan. All right, so it's basically just giving you the same breakdown. And then the same thing for mail order. All right, it gives you the breakdown if you get your drugs via mail order. It's for a 90-day supply. It gives you the cost of each of these medications and each of the phases and the total for the year, which is going to be similar to the CVS total for this particular plan. And then it gives you the breakdown by quarter if you get those medications via mail order, because you're getting a 90-day supply. You're paying more, but it's for a 90-day supply each time. So, and then the other drug information just tells you the tiers for the medications, if there's any quantity limits. It doesn't give you the actual quantity limit. That's something we're working on. Hopefully CMS will be adding that to the tool soon. But it does tell you whether there is a quantity limit potentially for these medications for each of these in your example. Then it gives you the drug list, which is basically you could verify everything was entered correctly for each of the drugs, the dosage, the quantity, 30 per month, etc. So then there's a section about Part B drugs, which is a little confusing. It says chemotherapy not covered. Well, that's because they're not covered by Part D as in drugs. They're covered by Part B as in boy. So if you have a supplement like a Plan F or Plan G or Plan N, it's going to cover that 20%. And Medicare Part B would pay the 80%, and then the supplement would pay the other 20% for those drugs. So not to be concerned if you have, yes, they're not covered by Part D as in drugs, but they would be covered by B and then the supplement. Then there's some star rating information. In this case, the plan is too new to be measured, but you'll see a star rating on some plans there. And then there's some contact information if you want to call the plan directly. If you have questions, the phone numbers are there to reach out. So that's basically how you read these reports for someone that has expensive medications that are going to reach that final phase of Part D of Medicare. If you have any questions, you can call us at the number you see below. And I hope you found this video useful. You can subscribe to us on YouTube for any additional videos in the future. And we hope you have a great rest of your week. Thanks.